Good afternoon, everybody, and welcome to Rotary. It's so great to see your smiling faces today. To get us started are our greeters, Matt Crow and Amanda Ryder.
Welcome,
Hi, everybody.
Everyone. Hello.
Hi, thanks for joining and hope we have a great program today. And thanks again.
All right, thank you both very much for greeting. Now we've got our music with Teresa Atkinson. Teresa.
Hello, fellow Rotarians. So nice to see all of you. I saw what the topic was today. I'm super happy to see that we're paying attention to the big impact that COVID is going to have and already has had on mental health and substance use disorder. So having Dr. Gengler here from Comprehensive is I think it's going to be a great program. I think there's a lot of awareness lifting that we could do in our community. And as somebody who's been an employer through the last year, I've seen how hard this has been just on staff, on our patients. And I came across this song. It's by Alicia Keys originally, and she wrote this song for first responders at the beginning of the pandemic. This is a rendition of that song by a children's choir, and it's a little bit more geared to all of us adults who have walked this out and done the best we could and shined as brightly as we could throughout this entire pandemic. Teachers, parents, all of us this has been a really hard year. And I just want to remind you all that you're doing a good job. So that's what this song says.
You're the engine that makes all things go, and you're always in disguise, my hero. I see your light in the dark, smile on my face when we all know it's hard. There's no way to ever pay you back. Bless your heart, know I love you for that. Honest and selfless, I don't know if this helps it, but good job, you're doing a good job, a good job. You're doing a good job, don't get too down. The world needs you now. Know that you matter, 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 yeah. You're doing a good job, a good job. You're doing a good job, don't get too down. The world needs you now. Know that you matter, 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 yeah.
6 in the morning, as soon as you walk through that door, everyone needs you again. The world's out of order, it's not a sound when you're not around.
All day on your feet, hard to keep that energy, I know. When it feels like the end of the road, you don't let go, you just press forward. You're the engine that makes all things go, always in disguise, my hero. I see a light in the dark, smile in my face when we all know it's hard. There's no way to ever pay you back. Bless your heart, oh I love you for that. Honest and selfless, I don't know if this helps it, but
good job, you're doing a good job, a good job.
good job.
You're doing a good job, don't get too down. The world needs you now. Know that you matter, matter, matter.
Good job. You're doing a good job, a good job. Yeah. You're doing a good job, don't get too down. The world needs you now. Know that you matter, matter, matter. Yeah. The mothers, the fathers, the teachers that reach us, strangers to friends that show up in the end. From the bottom to the top, the listeners that hear us, this is for you. You make me feel it. You're doing a good job, a good job. Oh. you now. Know that you matter.
Thank you so much to our first responders, our healthcare workers, our mothers.
Thank you to our moms and our dads.
Thank you to our teachers who've helped us.
We know it's been hard, but thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you. Good job.
A beautiful selection, Teresa. Thank you so very much for sharing that. Now we have our invocation with Bill Williamson. Bill.
Well, greetings, Rotarians, Madam President. That song is an invocation in itself. Wow, thank you. I would love to know where to find that. That was amazing. As a pastor at Grace of Christ Church here in Yakima, I am acutely aware and grateful for our opportunity for the program that we have today, being aware of the toll that this pandemic has taken on people emotionally, mentally, spiritually, physically, and even relationally. And even as the impact on people's lives due to the unsettled tensions in our country continue. So it's an honor for me to just allow us to pause and to pray and to be reminded of a God who is still sovereign and merciful, who still cares for us and loves us. So allow me to pray for us. Dear God, I come to you asking for your help in keeping us strong and healthy in body, mind, and spirit. I thank you that because you created us, you know our inner thoughts. You know all of our fears, our hopes, and our dreams. Only you are the one who knows about our emotional needs, and only you can provide what we need. But I thank you that you are the source of health in our inner being. And I pray that for those who are suffering emotionally and mentally as a result of this pandemic, that you would give them strength to rise up, to seek help, and to find hope. I pray that you will continue to develop in all of us that which creates emotional wellness. Renew our minds daily and keep our thought processes clear. Help us to overcome negativity, judgmentalism, worry, anxiety, fear. I thank you that you understand our feelings and that you hurt when we hurt and you rejoice when we rejoice. Guide us to use and express our emotions in appropriate and healthy ways. Comfort us when we are hurting, calm us when we are distressed and anxious, heal us when we are broken, alert us to when we are overreacting, prevent us from acting before we think. When we are overcome with negative emotions to the point that they're interfering with our life and the joy that you have for us, guide us to seek help from others. Show us how to handle stress, guide us in how to keep our life balanced, open our eyes to that which we can do that will replenish our mind and spirit and care for those around us. Keep us from being alone and isolated. Deepen our friendships, strengthen our family ties, connect us with others who share our faith, draw us closer to you. I pray all of this in the name of the Father and the Son and the Holy Spirit. Amen.
Thank you, Bill, very much for those wonderful words. Now we've got an announcement with Dan Sullivan to talk about a century of service. Dan.
Thank you, President Jennifer, and good afternoon, fellow Rotarians and guests. Glad to be on the agenda today to talk about our Century of Service event, which is fast approaching. We are 2 weeks out from the event. As a reminder, the event's going to be Thursday, May 13th from 7 p.m. to 8 p.m. You can watch the program either on KView, the local ABC affiliate, or you can stream it from the web at yakimarotary.donordrive.com or our Rotary website at yakimarotary.org. The team's working on putting the final touches on the show. We are really excited about how the program's coming together. This has the promise of being a pretty impactful production that we will all be proud of for years to come. Dwayne, if you could run the promo. We have a promo here that'll give you a little bit of taste of what is coming.
Hi, Charlie Robin here with Bridget Terrell, inviting you to join us for Yakima Rotary, A century of service.
Find out how Rotary is making all our lives better through all the incredible things they're doing here in Yakima.
Watch Thursday, May 13th at 7 p.m. on Cap KView.
You know, so as you can see, you know, Charlie and Bridget are going to be our host for the evenings, sharing their immense talent and professionalism. They will do an outstanding job. The format of the production, again, as a reminder, will be kind of a telethon style format. We'll be asking for donations during the event. We'll have a phone bank. People will be available to donate directly through the website. So we're anticipating good activity that night, but you do not have to wait until the night of the event to donate. As most of you know, this event is replacing our traditional biennial auction. We'll not be having an auction. We will not be auctioning items off during this program. You may be asking yourself, if we're not having an auction, how are we going to raise the money that the auction normally brings in? And that is a very good question. Actually, a question that has caused a lot of uneven sleep for those of us on the Ways and Means Committee for the past 12 months. For this year only, this COVID impacted year, we are going to raise the money through direct contributions from Rotarians and hopefully from the broader community. Over the last couple of cycles, the auctions have netted Rotary roughly $300,000. And this money is central to financing the service work that we do over a 2-year period. So our goal is to raise $300,000 on this event. This is new. We have not gone down this path before, so we're not too sure what to expect, but this is kind of how we're planning on putting this together. We have currently raised roughly $130,000, $130,000, $135,000. This is primarily from our sponsors. Thank you to the sponsors for sticking with us, and from our current and past presidents, with President Jennifer and Terry leading the way in a very significant way. She is not asking us to do anything that she is not already doing in a big way. So we'd like to build upon this foundation, right, over the next 2 weeks with contributions from members and membership. And so if you can, don't wait to donate. You can coordinate your donations right now by calling or emailing Carolyn. She'll bill your account. You can go to our website, yakimarotary.org, to donate online. But with your help, we would love to get, you know, much closer to our goal by the time we air on May 13th. Then the night of the show, we'd love to have a large viewing audience of Rotarians and non-Rotarians, and good donation activity that night that'll bring us to goal and beyond. A couple of notes about donations. If you would like to be recognized during the show for your donation and your support of Rotary, we need to know that before Wednesday, May 5th, Wednesday, May 5th. CAP needs time to kind of load the names up into the system. Your name would be appearing on a ribbon that is scrolling along the bottom of the screen during the presentation. So if you would like to be a part of that, please let us know about your donation before next Wednesday. You know, I have mentioned the kind of cash donations, but I do want to make it clear we do accept shares of stock. And for those of you who are over the age of 70, who are required to do minimum distributions from your IRA, a great way to help Rotary is by directing some of your required minimum distribution to Rotary through a qualified charitable distribution. Last thing, with regard to the help that you can provide, please invite your friends, your professional network, social media, to participate, to share in the event, to watch the event. The more folks we have watching, the better the odds we have of actually reaching our goal. One thing before I end, just a couple of comments about the team. As many of you know, the auction is a big effort. It requires a lot of coordination. We started this effort almost 2 years ago. COVID's thrown us a few curveballs, requiring the team to adjust, first with a reschedule, then recalibrating to this new format. It's been a lot, but the team that's been working on this has been outstanding. They've been flexible, adaptable, and shown incredible endurance and good humor. You know, the team, Charlie Eglin, Kurt Laberton, Charlie Robin, Bridget Terrell, Betty Jo Murray, Sarah Morgan, Brad Kessinger, Kyle Curtis, David McKinney, Amy Mabe, Teresa Pritchard, Bruce Bacon, Sherry Green, Darlene Picotti. I mean, all these folks deserve our congratulations and our recognition. And particularly Jennifer, Quinn, and Carolyn. The work that these three women have put in over the last 2 years has been immense, and the leadership that they have provided has really been remarkable. So well done, Jennifer, Quinn, and Carolyn, as we kind of put this thing together. So that's it. Back to you, Jennifer.
Well, Dan, thank you so very much. It's been a real pleasure to work with all of you and indeed to make these changes that are necessary during all of this strange year that we're in. I just really appreciate all of those volunteer hours that you've all given, and certainly the financial support of this club. It is absolutely true that this is the money that is going to power us through the next 2 years. And we want to keep doing those scholarships. We want to keep doing those playgrounds and all of the amazing things that we do in this community that we're going to celebrate that night on CAP TV. So I'm looking forward very much to a successful fundraiser and all the great work that we're going to be doing in the next 2 years. So again, thank you, Dan, for that announcement. Now we're going to move on to Sergeant at Arms, Margaret Filkins. Margaret.
There we go. Thank you, President Jennifer. Hello to fellow Rotarians and guests. We have a PowerPoint of today's Sergeant at Arms. Okay, next. Is someone in charge? Next page? Oh, there we go. So today, April 29th, is International Dance Day and International Noise Awareness Day. I thought it was interesting that both of those combined. So we have some questions about those. First one. What year Bring Into Noise, Bring Into Funk opened on Broadway? 89, 93, 1996, or 2000? Charlie, keep your mouth shut. Just kidding. Let's try the answer. 93? April 25th, 1996 at the Ambassador Theater. It opened off Broadway in 1995. So if anybody's like, wait a minute, she's off by a year, that's why. Yeah, thanks, Quinn. Okay, so what movie is about a dance marathon? They shoot horses, don't they? Strictly Ballroom, Dance, 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 or Mustang Sally Dance? Now, somebody gave me this question. I want to see if they fire off with the answer. Let's go to the next one. This one surprised me. They shoot horses, don't they? It was released in 1969. Okay, next one. This person holds a record for the longest marathon dance record. Is it 72 hours, 98 hours, 126 hours, or 152 hours? 98. Thanks, Mamie. All right, David fired off with the right answer. It's 126 hours. And that person's name is Bandana Nepal. And she set the record in Nepal between November 23rd and 28th, 2018. Next one. What was the loudest rock concert ever? Kiss, Doug Rich, Sleazy Joe, or the Rolling Stones? Doug Rich, yep. All right, let's try the answer. Yeah, somebody got it. Alan, you always know the answers. It is Sleazy Joe, which I've never heard of, but they set the record in Sweden in 2008. 143.2 decibels. So Doug, you got some work to do to pass that, but we're ready. Next one. Who originally sang Dancing in the Street? Martha and the Vandellas, David Bowie and Mick Jagger, the Struts, or Charlie Robin? Been there, done that. I think we all have. Martha, the Struts, Martha. Alan, I'm going to charge you double because I watched you on Sergeant at Arms and your brain is way too quick. Alan is right. It is Martha and the Vandellas. Released in 1965. Where is the quietest place in the world? The Mojave Desert in California, Olympic National Park on the coast here in Washington, Minneapolis, Minnesota, or Redmond, Washington? Mojave? No. Let's go to the answer. I only had one answer out there. Olympic? Nope. Check it out. It's at Microsoft in Redmond. It's building 87, negative 20.6 decibels. Isn't that amazing? What is the national dance of the United States of America? The hokey pokey, the American slide, the square dance, or tap dancing? I think John Cooper just called me a square, but I'm not sure. Oh, you folks are smart. It is the square dance. There we go. Everybody go out and make some noise while dancing like nobody is watching. Have a great day.
Thank you very much, Margaret. Appreciate that. Don't forget to send in those fines to Yakima Rotary Charities. Now we have our program introduction, and that is Kelly Gasling. Kelly.
Hello, all. Teresa's video was very fitting for today's speaker. We're very lucky to have Ron Gengler with us today, as he is the Chief Clinical Officer for comprehensive healthcare here in Yakima. He's a licensed mental health counselor. He's been with comprehensive healthcare since 1992. Ron was a therapist and clinical supervisor for over 22 years before moving into his executive leadership role in 2014. Ron was one of the original Washington State consultants for trauma-focused cognitive behavioral, that's a mouthful, therapy. He served on the Washington State CBT Steering Committee. He's been a consultant to the Child Abuse Neglect Coordinating Council of Yakima and court-appointed special advocates in Yakima. He's a member of the National Center Advisory Board, which provides recommendations to the National Center for Evidence-Based Practices. I want to really thank Ron for joining us today and educating us on everything you and comprehensive healthcare does for Yakima and beyond. So please welcome Ron.
Thank you. I don't remember who very much, Kelly. Thank you for, I sound much better on paper than I do in my own head. So I do want to thank for this opportunity to talk with y'all. I know that it says 25 minutes, and so somebody hit me on the back of the head figuratively. For Lorna, I said that once in a soccer game. I used to coach the Natchez girls soccer team, and one of the girls took me up on it and smacked me in the back of the head during a game. So it's an honor, and I'll try to figure out how to share my screen to make sure that we're going. Yep, I said it. Share. There's a little blue button down there. Okay, I don't want that one. We're going to get to that one in a minute. I want that one. Ah, sweet. Okay. So yeah, I've been with Comprehensive for 22 years. I've been in the behavioral health field for a little over 31. And it's been an honor to work in this field. Each of the stories that I've heard as a counselor and the privileges have transformed who I am and transformed my thoughts about humans and what we can do to be supportive of one another. So let's go through this real quickly. Just a brief snapshot because I've got 12 slides and 25 minutes, so I've got to save some slide time in other places. That's us. We've been doing this for quite some time, and it's been an honor to serve in our community and to work with folks who are struggling with behavioral health challenges. Did that one. All right. What happened during COVID-19? What happened for us is that we needed to take a deep dive into telehealth and into the tech world. We had Mike Norton I'm a member of your group, and he was one of the folks when he was employed with us who got telehealth off the ground here at Comprehensive Healthcare and really helped us start providing psychiatric services across our different communities from folks as far away as New York, who would come in and do telehealth for our clients and our patients. What that helped us get prepared for was COVID-19. I think a lot of the things that we have done throughout the last maybe 5-10 years or so has really helped our society be prepared for COVID-19. I think it's something that we sometimes don't express appreciation and gratitude for, of having one of these little cute thingies here and being able to practice with Facebook or FaceTime, being able to figure out Zoom and Microsoft Teams. And so this deep dive has really helped us to be able to continue to provide services. The number of clients that we saw dropped, but the number of services that we provided increased. And there were lots of fears of people wanting to come out of their homes, and that's the biggest reason we saw a drop in the clients. So we did some other things that I know a lot of you have had to do, is you had to work from home. Now we're realizing that we need to get people back into the office so we can have face-to-face. As a therapist who used to do a lot of trauma work, I specialize in helping kids and families overcome sexual abuse as victims. I can't see from here down when I'm doing Zoom therapy. I can only see from here up. And the number of times I would sit and stop and to ask somebody, what's that mean, where the foot is bouncing around in the chair? Those were some wonderful opportunities as a counselor, and maybe one day we'll have a better electronic system to be able to capture that. But you also can't capture the feeling within a room through telehealth. And so we've learned to realize that we need to get people back into the office. The other thing that Comprehensive did was we jumped in with the Sunnyside Community Center and helped to do the COVID testing. And we're constantly having to evaluate the model. What is the best form of treatment to help people? I don't know if that's ever there should never be an answer for that, because it should always continue to improve. Now, quick review of the data. I'm going to talk really, really fast because I want to get to the fun stuff. So lots of research has taken place in the last year. And so there's research out of China, out of the United Kingdom, out of the United States, out of Europe in general, that have collaborated, that I've taken those research and collaborated them and put them together. And this is some overarching themes that have taken place. So if you see from what was happening pre-COVID 2018 to what's happening in 2020, we're still gathering research and more information is going to come back. So here's what we know. From 2018, 14% of respondents endorsed feeling psychological distress. That's a 10% increase from 2018. That's a big jump for you in the medical world or in the financial world. That's a massive jump to jump 10%. The next statistic, 1 in 4 adults reached a diagnostic level of depression and or anxiety in 2020 compared to 1 in 20 in 2018. That in and of itself, 25% are endorsing depression and anxiety. Now, that doesn't mean that everybody needs to go into full-blown behavioral health services and be on medications or anything like that, but there's enough symptoms to be at the mild depression level or at different kinds of anxiety. The next one was interesting, which is kind of scary though, that in 2020, the suicidal thoughts, the ideations, not wanting to develop a plan or have the means and putting all that together to attempt, but at least having passing thoughts, reported 10% of that sample group. But in 2018, the similar sample group was about 3%. That's a big number. I mean, COVID is something that we don't know how to prepare for. This is the first time that we've ever experienced this. The information that we took from 1918 doesn't apply today. And those are some opportunities that we've had to go together, that video and that song of you did a good job. I mean, it's simple and it's basic, and the support and help that came from our first responders. And I would imagine in this group, there are a lot of first responders. Then we found out that there's a population of folks that are a little more vulnerable to the challenges of COVID. People with pre-existing mental health histories, women, young adults, and that's between ages 18 and I want to say 25, but I've got a 30-year-old. And so I'm going to say that he's still in the young adult age just because of some of the things that I see him do every once in a while. He's visiting from Ohio, so I can say that right now. And then those folks who are struggling in social interactions and also the economically deprived. There's not a lot of resources to go to. Where do I go if my broadband is not working very well? Who do I connect with? And a lot of times they were living in areas in which your next door neighbor was right there, but you were afraid to go out because we didn't really know what was going to happen with COVID and how transferable that disease is. Then the healthcare workers. This is what I found interesting, is that similar studies have been replicated 15 different times over the last 12 months. And this is kind of the themes that were happening with a healthcare worker, that 70% of them were experiencing psychological distress. 50% were endorsing clinical levels of depression, and 45% were experiencing levels of anxiety. When you're on the front lines, I remember when we first started and we were sending therapists home, we couldn't send our inpatient folks home. They needed to be there at our Bridges facility or our SELA facility. Lots of fear. What's the best form of mask that we need to purchase or that the county was graciously providing? Lots and lots of different kinds of cleaning solutions. Do we bring in air exchange units? What is it that we can keep our healthcare workers that are on the front line that can't really go anywhere to help them feel safe and comfortable? Now, then on compounding these additional challenges up there, we're back to what are the high risk factor groups? Females, nurses, those people who are experiencing stigma. And what I found interesting about this is that when they talked about stigma, it ranged pretty broadly, that if you're struggling with stigma, with people labeling you, microaggressions or those kind of things, that is compounded when you're isolating and when there is fear nationally or even at a world level. So mental health stigma, racial stigma, gender stigma. And then those who are struggling with what's the best way to help cope. We know that alcohol use as a coping mechanism is extremely ineffective and creates additional behavioral challenges. And with the isolation part, we were asked to isolate, and that term social distancing really didn't make a lot of sense. And that we know that there was an attempt to call it physical distancing, but it didn't take, because you didn't want to hide away from people in general. Those were some challenges that we were experiencing. So what are we supposed to do? And this is the part that listening to that video, I don't want to minimize what are the things that we can do, but there's not a lot of brand new things coming out there. So I want to talk a little bit about that. Are we using information that's accurate? Are we double checking when we see what's the current rate of mask usage, what kinds of masks use? The church that I attended start to allow people to sing, but you had to have a 3-layer mask. I don't know how hard it is to sing hymns when you have a 3-layer mask on, and so I sing it in my head. And then we've got this statement, until proven otherwise. There's lots and lots of websites and things out there that talk about what we should be doing, what we shouldn't be doing, what type of theory, whether it's conspiracy theory or not, is out there, is causing lots and lots of challenges for folks. So what do you believe? Right now for us here at Comprehensive, it's easiest to stick with the CDC guidelines right now. Are we getting vaccinated? Are we being good global citizens and trying to curb the spread of COVID? Again, you have to make that individual decision for yourself, whether you become vaccinated or not. The current research says what Pfizer, Moderna, and Johnson & Johnson's effectiveness is. Are we going to be wearing masks as a supportive person for the area, for those people who are on the front lines? I think for me, I hate the mask. I cannot stand the mask. However, I do know that when I'm out in public, and then I'm going to put it on because that's what I need to be doing for my community. I need to be supportive of those people that may have health conditions and challenges that make it more difficult for them to get out. And it's also, I need to set some examples for my grandkids. I think it's important that these are some things that we don't know if it's 100% of what's really the most effective thing. We're still gathering research. With mask, what was the last one? The CDC made some comments about if you're outside and you're not in a large group, you don't have to wear a mask. Okay, but there's going to be some additional research that's going to come in the next few weeks that we're going to have to look at again, and be willing and be flexible, I think, is what we need to do. And then what's the current social distancing? Now, the reason I said that is that helps us feel a sense of what we can do. What is the current science saying that we can do until some additional research comes out that says this is different, or this is better, or this is worse? Because I think if we have some sort of direction, it helps reduce the unknown, and unknown is where the stresses come from. So the other thing we should be doing is we consider others. Are we fighting against any kind of stigma? And are you trying to learn the stories of those people around you? If you're seeing people who are struggling, there's a story behind maybe the struggle that we don't truly understand. As a trauma therapist, it was an honor to hear the number of different stories I heard over my 22 years of doing that type of therapy. And again, each one transformed me. And that the behaviors that they were exhibiting before they came in to see me were influenced by the story of their life. And I think it's really important that sometimes when we see behaviors that are kind of scary or kind of concerning for us, or cause again, some angst or some anxiety, do we find out what's behind that? And I'm not asking you to go stand and do the stuff that Mike Johnson is doing at the Union Gospel Mission and try to understand everybody's story, but there's a story there. There's a story behind somebody's homelessness, or there's a story behind somebody's struggle with alcoholism. I spent some time in Comprehensive's methadone clinic a couple of years ago, and I just spent a couple of weeks just talking to the folks. They became my new heroes of people struggling to overcome opioid addiction, and what they were willing to do to work on that addiction that they had in their life. There were some amazing stories and of trying to overcome. I think it's important that in a trauma-informed society that we try to figure out what's behind the challenges. That doesn't mean that we should be judgmental, and I appreciate the invocation of talking about that. How do we be supportive of one another? It sounds like I'm saying a lot of the same things: be supportive, be kind, be compassionate, but that's really the only way to do this. And I'm going to get into something called my strength here in just a minute. But what did we learn over COVID? Did we learn there's anything special, really cool? No, we didn't. We learned that the things that we've been out there to help us deal with stress and deal with pressures of life, they're still there. And they're still very, very effective if we're willing to put in the time to learn and to practice them. I think this group is a group of amazing professionals that put in time into your profession. You put in the hours. Do we also put in the hours to do our own self-care? I would think sometimes we may do some things, but we may not do them as intentionally as we need to be. So, healthy ways. Do you do something that's enjoyable and healthy? There are lots of things that are very enjoyable, but they're unhealthy. And there are lots of very unhealthy things that are enjoyable, or unenjoyable things that are healthy. I mean, you think about what is very healthy and unenjoyable. There are times that I cannot stand eating certain kinds of foods, but I do know that I need to be more attentive to my diet and to my intake. We can learn things over time. So I think, again, it's both enjoyable and healthy. And am I speaking to anything that's brand new? I would say none of you is going to say, duh. That's really what this is they're there. Now, we need to take time for ourselves. I want to be really cautious about take time for yourself. In the psychobabble world where I reside, the statement is you can't take care of anybody until you take care of yourself. I think the theme of the Rotarians is probably something that you're going to know much better than I am, and we're going to get to that in a minute. However, do you still take time for yourself? Are you mindful? Are you practicing being in the moment right now? Are you attending to what I'm talking about and what's in your head, or are you attending to what's on your phone or on your screen? If you got dual monitors, do you got your email up and doing the presentation at the same time? Sometimes I've been guilty of that, and we've got to be really, really cautious about, are we being mindful and being present in the moment? Because this is the cognitive triangle. I'll put it on my white shirt so you can see it. You got your thoughts, your feelings, and your behaviors. This triangle exists at every waking moment of every day. Right now, the event is we're in a presentation together. What are my thoughts and my feelings, and what am I doing? Am I being attentive and being mindful? Because when I'm more mindful, then I tend to have more thoughts that are helpful and accurate than unhelpful and inaccurate, which then leads to much more positive feelings if I have much more clear, helpful thoughts. Now, the next one about meditation, and these kind of all go together, because you can do mindful eating and you can do mindful exercising. You don't do a lot of mindful sleeping because you should just be asleep. But meditation, when September 11th, 2001 happened, they did some research on the survivors of 9/11, and they found about 3,000 people that were willing to stick in with the study. The number one thing that this group of people did to help them deal with the trauma was meditation. It was better than psychology. It was better than taking medication. Meditation was the number one thing. For me as a counselor, it's like, okay, people have factors, resiliency factors that we don't tap into sometimes. And each of you have a few strategies and skills that are your go-to events. Are you attending to those strategies and skills, and are you helping your friends and family with theirs? Plenty of sleep. We know about these eating habits and exercise. Do you have, or do the people you're working with, or for your friends or family, have good sleep hygiene? If you Google sleep hygiene, you'll be pretty surprised about what they recommend should be in your room when you go to bed. If you got a TV in your room, you probably don't have really good restorative sleep. If you spend a great deal of time with the blue light from the back of your iPad, iPhone, tablet, Galaxy, whatever it is, you probably don't have really good restorative sleep because your brain is not conditioned to use that kind of light to help you relax. It's designed to stimulate you. Are we using those kind of things? And so I would challenge yourself, go Google sleep hygiene and see what it recommends that you should be doing. This last one here, avoid excessive. it was kind of weird. Why would you say excessive tobacco? I didn't know that any part of tobacco was really, really good. However, that's what they were recommending. And then this last one here is, are you staying connected to others? And this is going to go back to being in service to one another. So I've got about 5 minutes left. And for those of you that live in Yakima County, which I think is all of y'all, Yakima County, again, put together My Strength in connection with this company. Live and Go is the name of the company. I think they've even changed it since then. But Comprehensive had already been involved with My Strength, and we're purchasing it for all of our community members and clients. What we found with this company, My Strength, is that when you sign up with them, and so we pay a membership fee for all of our clients, but what they've allowed us to do is to give away this access code right here to anybody within our community. and people can go in and sign up for My Strength. Now, I'm going to jump out of this real quickly and show you My Strength. Here it is. Get rid of all of this stuff. So are you seeing the little screen? Nod your head if you see COVID-19 and mental wellness. No, you don't see it. Thank you, Jennifer, for letting me know that you don't see it. Share new screen. I want that one. Share. Do you see it now? Yes, thumbs up. Nicely done. Okay. So My Strength. It is an app that's been around since 2010, and it's something that I found very helpful. So this is my personal page. And I'm going to show you how to get into it. But the reason I'm showing it is that even Yakima County has offered My Strength for this year to allow people to get in and try to help themselves and to help out one another. So I'm going to go back to my homepage real quickly. And I can track my overall health in the different areas that I want to track. I can set a new goal. I can deal with sleep, or I can find some popular activities. What we do here at Comprehensive now is before meetings, we're doing a mindfulness minute. We're doing some sort of wonderful, positive statements to help us be grounded. But you can go up to here. It will walk you through what you need to do. And I apologize for going so rapidly because I wanted to show you this. You can give that access code, and I'm going to share it with you again, to your friends, to your employees, and it's free for life. And it's a wonderful opportunity. Again, it's something that Comprehensive felt is really important because of today's technology. As a therapist, I would have loved to have had My Strength because I could have assigned somebody some activities to deal with for depression. I could have given them what are some other things that we can do to practice behavioral activation, which is a psychobabble word for go do something different that's fun. So really, I think as a community, are we working together to, what's the impact of COVID? So you begin an activity, and the activity will give you some brief information about what's taking place. You can go to next, it'll give you some additional information about washing hands. And these are some very basic ones on COVID-19. The ones that I spent most of my time with is this one right here. Because I can do a mindfulness activity. I can do this 5-day challenge and just practice being in the moment for 5 minutes a day for 5 days in a row. If you're into yoga, if you're into meditation, this is probably going to be pretty easy for you. If it's something new, then I would give it a shot. They also have something, and again, I saw the gentleman that offered the invocation, and then Mike Johnson, they've got a gratitude challenge in My Strength, or for 5 days in a row, you think about gratitude. We know that research is showing us that those people who are intentionally grateful, I'm going to slow down just for a minute, intentionally grateful for somebody, not things, but for somebody, tend to have much stronger connections in their frontal lobe, the front part of their brain, and they have much better control of their fight, flight, or freeze part of their brain, going into anxious states or depressed states. When you're intentionally grateful, it's not the solution to everything, but it's something that are you practicing on a routine basis. You're supposed to drink 8-ounce glasses of water a day. How many of us really do that, and how many of us really know that? I would say most of this group knows that because of who you are. But do you do it? When it comes to being grateful, are you intentionally grateful and think of that one person in your life that means who's so near and dear to your heart? So I'm going to do a real quick one because I know time is up. I want you to think of a stressful event that happened this morning. Now I want you to picture a person who means so much to you, who makes you smile, who gives you a warm feeling in your heart, and makes you laugh. I want you to picture their smile. Now, what happened to this stressful event that you had earlier? Did it go away? Did you stop thinking about it? Was it less of a big deal when you thought of that one person you're truly grateful for? That's what I really want to leave with y'all, is that we have things that we can do to help take care of ourselves. And one of them is really expressing gratitude and being mindful of what we're doing. I'm going to finish this last slide and then turn the time back over to whoever, because I know I've ran over time. Where'd it go? Here, and then here, and then here. Go to My Strength, type in Comp Health Community, get an access code, give it out to as many people as you want to. There's the sign up. That's your motto. It's not a surprise. And the last part is that remember that next month is Mental Health Month. Are we going to be of service to other people and utilize the things that we know are helpful? Because you know what makes you feel good. I'm not going to give you anything brand new other than My Strength. And take some time to spend in it. And I thank you so much for the service you do to the Yakima community, and for the care and compassion. I see heard a lot of joking, waiting for this thing to get started. And clearly you guys have a lot of care and compassion for one another. Thank you so much for your time.
Thank you so very much for joining us today. I would like to say, in honor of you speaking, we are going to be making a donation in your name to our Yakima Rotary Charities. But again, I'm grateful for you to be here today and share that message with us as well. We are getting close to the end time, but what I would like to do is, if Dr. Gengler has some additional time after the meeting for questions and answers, are you able to stay on?
I do. Stop calling me Dr. Gengler, because I'm not a doc. That's what...
My apologies. I thought I picked up on that from Kelly. So sorry about that. We certainly are appreciative of you staying on for some additional time after our formal adjournment. But before we get to that part, we do have Kelly Connaughton, past President Kelly, is on to give us an update on the Rotary Playground at the Greenway.
Thanks, Jennifer. Thank you, Ron. Thank you for those tools. Those are wonderful, wonderful things for us to have. And if you're looking for something to mindfully get engaged in, we have the playground build coming up the week of June 21st through the 27th. And Ron, I'm going to call you to get a team from Comprehensive to help us. This is going to be the largest community build we've had since 1992, when they built the first McGuire playground. Sign Up Genius is going to be available here within the matter of hours, I am convinced, because our schedules are changing. And what we're doing right now is putting together our committees. I'm looking for more people who'd like to be on a food committee. And all you have to do is think about food for a whole week for about 2,000 people. So easy job. But we today signed up Perry Tech students. We've got Habitat for Humanity contractors all ready to roll. So during that week, we are going to drill 200 posts. We're going to cement them in, and we are going to saw and cut and do all the things to make at this most amazing playground. You'll be receiving an email within a matter of a couple of days that will provide you with the opportunity to sign up for different shifts during that week. And literally, we are taking a blank piece of ground, and in 6 days, having a full structure complete with fence posts and everything else. So we need everyone's skill set, from contractors to folks who know how to paint, and just even building the desks recently. If you know how to screw in one of those screws, you're our person. So please plan on that week and getting involved at some level, because this is really going to be a one-of-a-kind event for us during this very unusual past couple of years. So I'm looking forward to it. Thanks, you guys. Love you all. Thank you for all your help.
Thank you very much, Kelly. We'll look for that email in our inboxes soon. And now to wrap us up with our Rotarians Are Going Places segment, we have Mamie Barboza. Mamie.
Thank you, President Jennifer. Hello, fellow Rotarians. Good afternoon. This week we have one of our Rotarians to highlight. You may have noticed that last week, the Washington Court of Appeals Division 3 had a panel of judges hear oral arguments in 2 appeals cases. What makes this noteworthy is that it was the first time in its history since the Spokane-based division was established way back in 1969 that the panel was made up of all female judges. What makes this rise to the level of Rotary news and a spot on our segment is that our very own Chief Judge Rebecca Pinnell was one of those 3 judges and part of that historical event. In an article highlighting this event, Rebecca is quoted as saying, "This moment in our court's history is long overdue." We agree with you, Rebecca. Congratulations.
Excellent. Congratulations, Rebecca. It's so wonderful to see that great news. Thank you, Mamie, for that. Next week's program on the 6th of May is going to be Lowell Kruger, who's going to talk about the Yakima Housing Authority and the Chuck Austin Place. The week after that, on the 13th of May, is Gonzaga President, Thane McCullough. I don't want to get that wrong, Quinn. Okay, I see your Go Zags message. He's going to be talking about leadership. And the week after that, let's keep our fingers crossed that we're going to be in person on the 20th of May at the Convention Center, and to get to see all of you beautiful people in person. That program is our academic scholarship. So again, we're looking forward to that date of the 20th being back together again. With that, we're going to officially adjourn, and then we'll go ahead and open up for some additional questions of our speaker. So again, we're officially adjourned, but please feel free to unmute with your questions.